Hi everyone, I'm Stephanie with Nine Health. Today we're talking about women's health and the coronavirus during this COVID-19 pandemic, things you need to know if you're just a woman, if you're expecting, if you just had a baby. I have two great OBGYNs joining me today. I have Dr. Dr Larson and Dr. V. Rossi joining me. Thank you both for joining me today.
Our pleasure.
So first, we can get right into it. And if you have questions, please post those in the Facebook comments and I'll get them answered by these ladies. They're OBGYNs, they can answer topics on women's health, really any health tip that you need. I'm sure they'd be able to give that to you. I will be looking at comments. So if you have questions, again, just post those in the comments. First, Dr. Rossi, I want to start with you. I think on a lot of women's minds right now, if they're expecting, I have just a few friends that are expecting, so I'm a little biased and want to know the answer to this question, but can you tell us what it looks like right now for moms that are delivering babies or about to deliver a baby during this COVID-19 pandemic?
Sure. I think that there is a lot of concern out there by women about whether to come into the hospital. And I think it's really smart for people to be conscious of those issues and speak with their doctors if they think they need to be seen. And then the doctor can, based on their risk factors and their presentations, decide whether the patient goes to the office or to the hospital. But clearly, if a woman is in labor, she should feel really confident that we're welcoming patients to the hospital and we're taking a high level of safety measures to keep her and her family safe. And they'll see that as soon as they arrive. They'll be screened on the phone as well as when they present. And if they are staying in labor, then they can have a support person at most facilities. But again, that's where the discussion with the doctor over the phone can help them not only decide whether to come, but also clarify what the policies will be for visitors, because support persons are absolutely desired, but sometimes the policies are particular to the facility as to how many you can have.
Okay, yeah, I think that's a rumor too that people have seen on social media is, women aren't getting that support person at all right now. But again, it is just dependent on your facility. So ask your doctor, ask your facility. I think for the most part, one support person is being allowed. Again, that's an important, I have a 4-month-old. I know how important it was to have my support person, my husband there when I had my baby. So it's a very important part of the birth experience. So hopefully that is something that people can have.
Absolutely, we know that's important. And so we really want to accommodate families in the safest way possible.
Yeah, I think the hardest thing right now would be, you've had your baby, but maybe grandma and grandpa can't come see the baby right away, or other family can't come see the baby right away. That would be
right.
hard.
No, that's a good point. But the other flip side of it is if you do deliver, we'll do everything we can when it's medically appropriate to get you home safely with your family so that you can visit them in the privacy of your home. That would probably be the best setting for most families anyways.
Right. So Dr. Larson, I want to talk about, general women's health as well. And I wanted to let you kind of introduce yourself a little bit. I didn't let Dr. V do this, but I can let her do it as well. You've been retired for 4 years, but you're still doing a lot of things. Kind of talk about what you've been doing since you've retired, and you're a Nine Health volunteer for us. So thank you for that. But give us a little background about what you've been up to.
Sure. Well, I was an OBGYN for 30 years almost now, and I've been retired from Kaiser the last 4 years, and I've been doing some really fun work overseas, working with mostly midwives and teaching them how to train other midwives on obstetric emergencies using simulations, so like real practice opportunities to help them handle those high-risk settings that we do so well with in the United States. It's great work.
Nice. And Dr. V, I'll let you introduce yourself as well. I got right into it with you, but let's just quickly let you introduce yourself as well. Where are you practicing right now and kind of your expertise?
Sure. I'm an OBGYN and I used to practice in the office, but now I'm considered what is an OBGYN hospitalist. So I work only in the hospital to take care of women's health issues. And most of that is obstetric labor and delivery care in hospitals around the area.
Great. And again, we're talking women's health. If you're pregnant, not pregnant, kind of all women's health topics right now during the coronavirus. Dr. Larson, if a woman has a regular annual exam right now, is that something that they should be rescheduling? Should they still go? I know I rescheduled mine at the beginning of all this, and I rescheduled it for May, and then they've called me and now they want me to reschedule. So I don't know when I'll ever get my annual exam in. Can you just talk about kind of that preventive care for women right now?
Sure. Well, I would postpone routine appointments. There are some urgent conditions that you should definitely call ahead for and see if you need to come in. Prenatal care, Dr. Rossi talked a little bit about that. And things are changing a lot, and this may be something that is ongoing into the future, even once this crisis is over. Lots of prenatal visits are now being made available, depending on your provider, via telehealth. So either with a phone call or a video call. And many providers are even teaching their patients or clients how to do blood pressures at home, to do their weight. And a nice thing is fetal kit counts, where you can keep track of the baby's movements over the course of an hour, counting and making sure you get at least 10 movements, and doing that a couple times a day even, to be sure that you're keeping good track of baby's health. And a couple other things to consider coming in for gynecologic care would be contraception. Don't delay those visits. Several types of contraception can be done over the phone, and things like IUDs and injections would need to come in for an in-person visit. Heavy bleeding, if it's heavier than a period. Abortion, I know, has been kind of controversial, but all the big gynecologic groups have put out a statement saying that it's important that is available for women in outpatient clinics or hospitals. Just for women who have to make that decision, the earlier it's done, the better. And then finally, abdominal or pelvic pain, things like tubal pregnancies or ovary cysts would be important to know about. So call your doctor or provider and ask whether you need to be seen.
Yeah, and you're right. A lot of that stuff can be done, telehealth first, maybe, and then your doctor will determine if you do need to risk, going into a hospital or the office. Dr. Rossi, let's talk a little bit more about pregnant women. What is the risk to them as far as, contracting COVID-19 coronavirus? I know when you're pregnant, your immune system is a little not as strong, I guess, is the best way to put that. So are they at greater risk for catching COVID-19? What extra measures should they be taking to protect themselves right now?
Sure. Obviously, the information on COVID-19 keeps changing. We do know that other types of viruses, like the influenza virus that we more commonly deal with and see, is more impactful, harder on pregnant women than you would see in a non-pregnant woman. So we're very careful about that issue specifically. When it comes to COVID-19, we don't have as much evidence that it's as hard on pregnant women. It's more difficult for pregnant women than for non-pregnant women. We don't have that information yet, but right now it seems like it might be similar to non-pregnant women. But because we know that pregnant women, as you said, their immune systems might be more challenged and that they have a harder time with influenza, we certainly want pregnant women to pay attention to the symptoms that we've been hearing about and contact their physician if they think that they have a chance of COVID, and to take those precautions that the CDC is already recommending. In general, we're still highlighting all the things that are important for non-pregnant folks, including social distancing, hand washing very carefully, and just being cautious of contacts. And right now, there's nothing specific to pregnant women, but if you are in a job that you can do telecommuting, it would be a very reasonable idea to have that discussion with your provider and your employer. And if you have high-risk medical conditions for the pregnancy or outside of pregnancy, your doctor would be able to discuss whether you need a different regimen or a different schedule for being seen in the office.
And then all good things. And if someone is pregnant and experiencing symptoms, they go into labor, Dr. V, maybe you can just talk about what would happen if, I guess, once baby's here. Is baby isolated right away? Is mom kept from baby? Talk about if mom's having any kind of symptoms, what is done. Sure.
So we do know that testing is right now still a little bit challenging to get consistently across the board, but certainly pregnant women are considered high priority if they are persons under investigation, meaning they might have COVID-19. And so testing, if it's available, would be offered. as well as the precautions of masking and whatnot in the hospital, in the facility, until testing is confirmed or not. But until that's clarified, not only will the patient be wearing those safety precautions, but all of her providers will be. And so that's something to be aware of and not to be concerned about. It's for the patient's protection as well as the provider's protection. So just be aware that your providers will have more on than you might have seen in the past. And that's for everyone's benefit. And depending on the situation, on whether the mother is positive, if the baby is positive, because that is always a potential, although we do know right now there's no transmission with current data that we have. We don't see it vertically transmitted is what we call it, and that it's not present in breast milk. But with those kinds of precautions in place, it might be necessary for moms to use masks if they're around their babies or breastfeeding, and doing extra hand washing to address those concerns while they're waiting for testing results. Does that make sense?
Yeah, and someone did just ask, when we covered this at the beginning, but are we still limited to one person with us for delivery? Is family allowed to visit in the hospital after birth? We covered it at the beginning, but maybe you can just address that again. It's really dependent on the facility you're delivering at, but.
You're right, Stephanie. Yeah, it is dependent on the hospital, and you can discuss that with your doctor, because the doctor who is your usual caregiver and would probably be the person you would see in the hospital or their practice, they would be up to date on the visitor policies, and they can discuss that on the phone with you before you even go to the hospital, as well as you can call the labor and delivery of the hospital that you will be presenting at. Or check their website, because every day we're getting updates on visitor policies and the appropriate approaches to all patients. And so that would be the right way to get the most up-to-date information.
Yeah, I think, and everything keeps changing every day. So it's just one more thing to add to that birth plan, to check if you can have visitors, the support person, before you go.
But most facilities are allowing at least one visitor, and that's usually just for the laboring patients.
Okay. And we touched on it a little bit. I don't know if you want to add anything, Dr. Larson, but just advice for breastfeeding moms right now. If mom does have symptoms, Dr. Rossi said, it doesn't transmit through breast milk, the coronavirus, but if mom does have symptoms, kind of advice for breastfeeding or just breastfeeding in general right now.
No, I think she covered it really well. Still encouraging breastfeeding. It's the best thing for a baby, and may help in the long term for all types of other infections, in terms of allowing antibodies to pass through to baby and protect your kiddo on through that first year or more, hopefully, if you're ongoing breastfeeding.
And for those that don't really know how that works, and I'm breastfeeding my 4-month-old right now, and I still don't really know how it works. I guess he's 5 months now.
Good for you. Breastfeeding at 4 months. That's a great achievement. Every month is a great achievement for breastfeeding. Right?
That's exactly how I feel right now. But especially since he still wants to hang out all night. But Dr. Larson, maybe just talk about the benefits a little bit of breast milk. Does it really help baby from getting sick? Does mother's milk really change as she's exposed to different things?
Yes, absolutely. There's really super data about the benefits of breast milk over formula, and or even when you start supplementing with cow's milk or something like that later on in the first year. Those antibodies do pass through to baby, and there are even some immune cells that help protect your kiddo from infection for the long term. Really good differences in terms of all types of infection, ear infections, upper respiratory infections. It's important. It's interesting to look at the difference in the baby's gut when you start introducing and it's necessarily and certainly very safe in situations where people can't breastfeed, but there are lots of good benefits, and important to keep that going as long as you can. We recommend 6 months and even longer, 2 years if you can do it.
But is it true that and maybe both of you can touch on this, but even if you're supplementing with formula or anything else, or my baby has started, some solids, any bit of breast milk is good for the baby and helps with that?
Absolutely.
As I've seen conflicting things
for premature babies especially, we call it mother's medicine, because they get so much benefit. And And I think Danica touched on a lot of those issues really nicely. And it's also why we offer women in pregnancies vaccinations as a part of their prenatal care, like the flu vaccine and the tetanus pertussis vaccines, because those are things that benefit the mom, but also can be passed through to the baby as a benefit when she breastfeeds.
Yeah. And in the future, probably the coronavirus vaccine is another thing.
Yes, we're all rooting for that.
Right. Someone did ask on here, and maybe this is best for you to answer, Dr. Rossi, social distancing rules with 20-week ultrasounds. I'm not exactly sure what they mean by that question, but are you still able to give ultrasounds, and providers and ultrasound techs are taking precautions, I'm guessing?
Sure. Appropriate prenatal care does include the anatomic ultrasound, which that viewer was discussing, and deciding with your provider when that's going to be timed is appropriate. We're trying to cluster care a little bit more so that you don't have to go in for as many visits, but the necessary ones like ultrasounds and testing, fetal monitoring are still being offered in a clustered approach combined with telehealth.
Okay, great. And then I wanted to talk about women's health in general as well. Dr. Larson, maybe you can start with this, but both of you can answer. Many of us are worried about catching coronavirus right now, but our overall health and preventing chronic disease, any preventive measures we were doing before we were, maybe safe at home in our homes, there are things we should still be doing. So what are some things that women should be doing right now to stay healthy and, prevent other health issues?
Well, I know it's tempting at this time when we're stressed to go towards comfort food as a solace, but if you can remember your long-term health and what makes you feel better and healthy right now, many providers encourage something like a diet like the Mediterranean diet, which is fruits, vegetables, whole grains, fish, olive oil, like 2-3 tablespoons a day. And if you're a vegan, some supplementation with something like a B12, or if you're an older person who has a little harder time metabolizing, in terms of additional foods and supplements, calcium and vitamin D containing foods like green leafy vegetables, broccoli, yogurt, milk, sardines are good. And then I wanted to mention vitamin D, especially in Colorado where the sun doesn't rise up above 35 degrees for several months. We can get low vitamin D stores right now, might be just starting to peak back up again. So take advantage of the fact that the sun's a little higher, and during midday you can get some UVB rays to help you make vitamin D. If that's not an option for you, if you're nervous about sunburning, you can do supplements, 800 milligrams of vitamin D to help protect your bones. And there's actually a little bit of data about upper respiratory infection risk, especially for kids. So making sure that kids are getting enough vitamin D. Let's see, of course, exercise, that should have been number 1, 2, and 3 on my list. It's tricky to get outside for sure now if you're in a place where you can't get that social distancing, but if you can get on a mask and get out and jog or walk or bike. Some people are talking about trying to keep some extra distance if you're breathing hard, and there's a term, double the distance, so try to keep a little further apart if you're blowing air towards or breathing harder in. Keep wearing your mask. If you can't get outside, there are lots and lots of options online, so you can do dance videos or fitness blenders. Let's see, just walking or jogging up and down stairs, doing some calisthenics, yoga, lots of great ideas. Trying to shoot for 20 minutes a day. And let's see, avoiding nicotine, alcohol, 4 drinks a week for women. Let's see, I have a kind of a fun list of S's. I had a nurse practitioner I worked with who talked about the 5 S's for keeping healthy for both physical and mental health. And I've added on, I've got like up to 15 now, but sleep is a big one we can talk about a little bit later. Sweating, so that's exercise, getting your heart rate up. Support, talking to people, clergy, friends, family. One that I like is scribbling. I'm kind of stretching here for the S's, but journaling is really good, especially for helping you get to sleep at night. A gratitude journal, maybe you've heard about. A couple other things we talked about: sunlight, another S; seafood, DHA, which is the fatty acid that's in salmon and trout, sardines, and that kind of thing, is really good for mental health.
Yeah, I'm vegetarian, but I had a vegetarian DHA supplement I was taking when pregnant. Is that something I should still be taking?
Absolutely. That's a great, yeah, they make them, I think, out of seaweed that they feed to chickens. Or,
yeah, I think I have then like flax seeds have omega-3s, right?
Yeah,
if you were to do flax.
Those are some good sources. So absolutely keeping up with that is great for your brain and your mental health too.
Okay.
Couple more if you're interested, but
of course, we'll take all the tips, and I'll let Dr. Rossi chime in as well. I know that Dr. Larson's giving a lot of good tips. The vitamin D thing is a good thing to point out, though. When we have our 9 health fairs and people get their blood labs done, most everyone is low on vitamin D, even in a sunshiny state like Colorado, where we have a lot of sunshine, but it's just about getting out at the right time and getting the vitamin D you need.
Yeah. And a lot of people are covering up or using sun protection. So the 400 to 800 international units is a good supplementary amount for most folks, just like you said, because most of us are not getting our blood work done. And it's a reasonable supplement that's in a lot of multivitamins as well.
And would you really notice if you were vitamin D deficient? Would you have a lot of symptoms?
Not really. That's the tricky part. It's kind of comes later on when you have osteoporosis and bone loss. So it's certainly one of those things to pay attention to, even when you're really young, because especially in your teens and early 20s, that's when you're with the calcium and vitamin D, that's when you're making your bones strong. That'll last you on through menopause, when those numbers start to drop down in terms of bone strength.
Right. Dr. Rossi, is there anything that you wanted to add as far as preventive measures we should be doing right now to stay healthy?
No, I like a lot of the recommendations that Dr. Larson gave because they're easy to remember. I think so many of the things that Coloradans do on a regular basis are very much a part of a healthy lifestyle. And I think that in general, if you combine those healthy lifestyle habits, including healthy diet, with the normal activities that are including social distancing and wearing a mask when you're outside to protect yourself and to protect other people, then you can still lead that healthy lifestyle even during these difficult times.
Yeah, and just trying to get exercise inside as well, or doing workouts online like Dr. Larson said. Someone said on here, and it kind of is a good segue to some mental health stuff, but someone said, pregnant friends I know are more concerned about their financial security more than anything. So I think there is a lot of stress on us right now as far as financially, the uncertainty of knowing where things are going next. Maybe each of you can touch on good things to protect our mental health. We talked about exercise, getting outside. I think those are good things to help your mental health as well. Dr. Rossi, I don't know if you can start with some mental health tips, I guess, that we should. And if you, I want to mention too that 9healthfair.org, there are 2 screenings you can take for free on depression and anxiety. They're anonymous. You can do screenings online and get some free virtual help as well. But Dr. Rossi, maybe some tips for protecting our mental health right now.
Well, I want to start with just giving folks some resources, and I did send those to Stephanie so that she can post.
Yeah, I can put them in the links here when we get done here, so I'll put those up.
That would be great. Especially thinking about postpartum depression and intrapartum depression for women who are facing the challenge of being a little bit more socially isolated during a time that they thought would actually be more about family coming together, and the challenges of sometimes not having as much support as you would have normally had. I love the fact that we have so many teleconferencing options, and I certainly encourage women to use those during these times. The exercise that we already discussed, but making sure you know what your resources are for emergency situations, because sometimes it is challenging to talk to family members or people not in the medical field about these problems because other people are stressed and we don't want to feel like we're burdening anyone else. Mothers have a tremendous amount of stress and guilt sometimes when it comes to relying on other folks. And one of the first things I always tell women who have a baby is if anybody says that they'd like to help, don't question it. Don't be humble or modest. Just say yes, and then think of something afterwards to ask for help. in terms of what you might want them to do. But if they know that you might need help, please just accept it straight off. Give yourself a lot of patience and a lot of leeway when it comes to the challenges of having a newborn and also having other children in the home. And know that breastfeeding is always a great goal, but sometimes it's really challenging, and it might not always accomplish the way that you were anticipating or planning. But give yourself a lot of room for those challenges that can be surprising, whether you're a first-time mom or a mom of 4. These are difficult times. And so those resources that I included there's a special postpartum depression line that's on there for women specifically after deliveries. There's, of course, the domestic violence line, because these are hard times for everyone in the home altogether. And also a couple other resources that you can find on the American College of OBGYN, which is our resource as OBGYNs to take care of women, whether they're pregnant or not.
Yeah, I think that's great to recognize. So, you know, you're planning on staying home maybe during maternity leave anyway, but it was going to include visits from family and more of an open door kind of come see the baby. So yeah, it's kind of like, extended maternity leave, but no one's allowed in your house right now. So yeah,
exactly.
It is.
But those meal trains, they can keep coming. You can sign up for all kinds of things like that. Zoom happy hours where you can commiserate with your friends that are also dealing with these challenges. All kinds of opportunities, hopefully, that we can make use of, not just during these times, but for the long term.
Yeah, and for those that want to help, you know, dropping a meal on a porch, some groceries on the porch, those would be very helpful for someone that's a new mom. Dr. Larson, anything that you want to add as far as protecting our mental health right now for for women in general?
Sure. And a couple other like S's that I was talking about. One was simple acts of kindness. So you just mentioned that. Anytime we can help with altruism or volunteering, that helps boost our own more morale in addition to how we're helping other people. So maybe a couple other things would be exposure to nature. So getting outside, there's some good data about things like the Japanese have something called tree bathing, where they're actually exposing themselves to some of the chemicals from plants and trees that help improve your mood, lower your blood pressure and pulse, and improve immunity. Soil is one. It sounds kind of weird, but gardening is great exercise, but it also exposes you to good bacteria in the soil to improve your microbiome. So that's something we haven't talked about too much, but I think focusing on that is actually a good way. If your gut is healthy, there's lots of feedback via the vagus nerve to keep your brain healthy. So working on even though it's kind of maybe hard for people to have as many fresh fruits and vegetables, but if you can get yogurt that has live cultures or sauerkraut, things like that, to keep a healthy microbiome. And prebiotics, I don't know that much about how good the data is on that, but certainly feeding those good bacteria with fiber and healthy fruits and vegetables is important. A couple other things, just smiling, laughing, watching videos, maybe trying to avoid if you're getting overwhelmed with all the negative information, but watching a comedy show or a movie, sharing jokes with people, with friends, sex or masturbation, sensual, just touch. Humans are crave skin contact. So it's hard if you're completely socially isolated, but asking somebody for a back rub or a massage can really help with mental health. Singing, if you can do a karaoke or a family Zoom event, helps with social connection. And let's see, there are lots and lots of good things if you can keep an open mind about a bag of tricks for improving your mental health. There's lots of ideas out there.
Yeah, especially right now, and just checking in on each other, taking care of each other, checking in on those that are home alone, or like Dr. Rossi said, a new mom, maybe just in their home, just checking in on people. I've kept you both longer than I said I would. You guys have been giving some great information. I did want to touch on sleep quickly. Dr. Larson, you mentioned sleep a little bit. Many of us are dealing with anxiety, stress, may have trouble sleeping. And you had mentioned, in our exchange before our live, women that are experiencing menopause, that's kind of a side effect as well, that you don't sleep as well. So can you share some advice on sleep, especially for those that are experiencing menopause?
Sure, real quick. So about 2/3 of women do have sleep issues going through menopause, and they're even beforehand, their 40s and 50s. And that can be caused by a couple things. There may be some issues with snoring that's increasing as we gain weight and we get older. Just watching out for signs of sleep apnea where you're not, where you're having long pauses between breaths, maybe having someone listen to you while you sleep, or gasping for breath after a long delay, something to evaluate and work up maybe as things go down the line. And then the dropping of hormones like estrogen and progesterone certainly can cause hot flashes or night sweats, may make you wake up at night completely soaked and cold. A couple things you can do for that are making sure you're in a cool bedroom, keeping on very lightweight bed clothes, or wearing nothing at all at night. Don't have a real heavy insulating blanket, but light clothes that you can, or light blanket or sheets that you can kick off pretty easily so you don't have to wake up entirely soaked. Consider soy products. There may be some benefit for hot flashes. And then if this is actually a great time for a teleconference with a provider about whether you're a good candidate for hormone replacement therapy. So for some people, if it's really affecting their sleep and therefore their mood and energy level, this is a good time to talk a little bit about that. And then
could you get over telehealth, just talk with an OB about that and get those hormones you need, or would that be a different consult with a different?
I think I've talked to a couple docs who are doing that, and they say this is a perfect situation where you don't really need an exam. You can get some labs beforehand, and it might be a reasonable thing. You have to talk to your provider about whether they're comfortable with that.
Okay.
And then a couple other things just for sleep, for non-pregnant patients, for all of us, because for sure when there's all this anxiety out there, I think good sleep hygiene is important. So things like exercise, but making sure that's 2 hours before bedtime. Also in those last couple hours before bed, just shutting down the screens and keeping off that blue light may be helpful in helping your brain start to think, okay, it's time to go to bed, keeping the lights low, avoiding alcohol right before bed, obviously caffeine, even things like teas and hot chocolate, maybe in the second half of the day. Let's see, avoid large, heavy meals, especially fatty meals. You end up kind of getting woken up in the middle of the night. And then having some things to do in the middle of the night if you do wake up and you're worrying and stressing about things. So have a piece of paper where you can jot down your worries and say, okay, I've got it written down. I'm gonna worry about it in the morning. Maybe have some meditation. There's some great apps that are kind of back to sleep meditation apps that help you just calm down and think about other things. Good relaxation techniques like that. And then, yeah, maybe melatonin for some people if they're shifting sleep schedules or traveling. Hopefully not too much of that at this time. Those are a couple more ideas.
Dr. Rossi, I'll give you a chance to add to that, but I also wanted to wrap up with some ways that people can help. So maybe you can add to anything that Dr. Larson said about sleep, and then I know you have something to share about ways people can help right now too.
Absolutely. Sleep issues, I think Danica did a nice job of touching on those issues, especially as how they relate to women who are perimenopausal, meaning that they're still having periods, but also having the symptoms of menopause and as they go into menopause. A lot of those issues are related to mental health, many times poor sleep. And so that is something also to be aware of, is that if these measures that Danica discussed aren't helping, you might want to also talk to your provider about what your mood is like, because that could be playing a role in why you're not having as much success at sleeping. That's something that can be kind of in the background for a lot of these other symptoms that can be more obvious. So yes, thank you, Stephanie, for mentioning this issue. I know that you had spoken about this on a previous teleconferences, the importance of blood donation during this time. Vitalant has seen a huge drop in how many blood donations are needed, and regardless of whether COVID is here, the need for blood is going to be still such an important part of how healthcare providers can provide the best level of care for patients, especially as we start seeing patients more again with surgeries and whatnot. And so it'd be really great if we could get people to consider blood donations. Our group, Donate for Mothers, is a group of women's health advocates, doctors, nurses, people who care about women and their obstetric complications that can include postpartum hemorrhage and various obstetric complications that blood donations would be so vital for. So in honor of Mother's Day and also the month of May that's coming, we're trying to encourage people to associate May and Mother's Day with blood donation, especially in honor of mothers. So if you'd be interested in doing that, we have contacts and links. Right now, the blood drives, many of the mobile ones that you're used to seeing are on hold right now, but the Vitalant donation centers and the University of Colorado donation centers are definitely up and running with CDC guided guidelines on how to keep people safe when they donate. Because just as the Surgeon General said, just because we're socially distanced doesn't mean we can't be socially engaged and still help by donating blood. And whether you're a husband, a father, a sister of somebody who might have had a complication in pregnancy, you can donate in their honor safely, even during these COVID times, based on all the extra safety precautions that are in place now for blood donation. So think about that for Mother's Day, Mother's May, and Donate for Mothers as well.
All right, and I'm going to let you guys go here in a minute. We did just get a few more questions right at the end that I want to have you answer. Someone did ask, is it true you can't donate blood when you're pregnant? So that's a good question to ask since you just talked about that.
Right. We don't have women donate in pregnancy or if there's a chance that they're pregnant. That's correct. And if they go to the Vitalant.org website /donor eligibility, they can see the specifics on the criteria, especially criteria that's updated for the COVID situation on when it's appropriate to donate blood.
Yeah, and when you're pregnant, you have more blood, but it's all needed for baby.
Exactly. But it's a great thought, and encourage maybe your family members who are trying to figure out a way to help you or to encourage you to donate blood for Mother's Day for you.
I think that's good advice. And either one of you could answer this question. Heather asked, for those of us who aren't pregnant but are planning to try this year, do you think it's advisable to wait until there's a COVID-19 vaccine if they're trying to get pregnant?
I've read a little bit about this, and I think in general they're saying unless you're at an age where there's some real decreased fertility, so kind of in your 40s, where you feel like there's some real time pressure, that it might be safer to wait a little bit longer before trying to get pregnant. I don't know, V, have you heard of other suggestions regarding that? That was certainly for reproductive medicine recommendations.
No, that's understandable, and I have heard similar recommendations. And this might be another perfect time to have a telehealth appointment with your OBGYN for preconceptual counseling is what we call it, where they, knowing your OB history, your medical history, and your risk factors for pregnancy, they can discuss the COVID risks as well as your other medical risks that can be fine-tuned or optimized so that you can have a really successful pregnancy. So that is a good thought, is to think ahead, plan ahead, and see if there's the best way that you can approach it with your doctor.
Okay, and then just one more question, then I'm going to let you go. And then if you have any other questions, you guys can post them in the comments and I'll get these ladies to answer them after the fact. But someone did ask about a recommendation once you're home with baby and family and friends want to come visit. And I think we talked a little bit about this, but just social distancing guidelines, as long as those are in place, practice social distancing, maybe don't let people in your home right away.
I would say that it's a good idea to be thoughtful and flexible about those things. And especially as we get new guidance with things opening up, that can change. And we're optimistic and hopeful for that. But again, being a little bit more thoughtful about how you invite folks into your space, especially with a newborn. And your pediatrician can also give you additional guidance based on your baby's needs.
And the same person also, she works in a dental office and she's concerned about being in contact with the public all the time. And working in a dental office, she's probably not able to telecommute. She can wear a mask. Is there any other prevention measures? I mean, just washing her hands. Is there anything else that she should be doing while she's pregnant and working?
That's a really challenging position. I feel for her because as a provider of health and dental health, she has to be very close to people on a regular basis. And those kinds of precautions that she already knows to do, and the extra hygiene measures that I know doctors' offices and dental offices will be doing, will be the best version of that she can probably achieve. And she might want to speak with her employer specifically about what they can do according to the CDC recommendations, because the CDC has all kinds of recommendations for different offices and health facilities on how to optimize the situation with COVID, and whether there are any other opportunities in the dental office that she can help without being directly exposed to patients, if that's a concern. And many offices are doing pre-screenings of patients too, to make sure that customers or clients that are coming in are not having symptoms or having risks before they even come to the office.
All right, great. I kept you both, I think, double the amount of time I told you I would, but you did a great job and we're answering some great questions. So thank you so much for your time and for answering viewer questions and giving us some great advice and tips. Yeah. What is that, Dr. Larson?
It took me a while to figure it out, but you remember your old nursery rhyme, this little piggy went to market, this little piggy stayed home.
All right, yes, I have seen that on social media a couple of times too. Yeah, be that little piggy, stay home if you can. And I do want to, before we leave, if you have a medical question, you can post some things here about women's health, but also if you have questions about the coronavirus or anything else, call our 9 Health Neighbors line, 303-698-4455, extension 2005. Leave a message and a 9 Health medical volunteer will give you a call back within 24 hours and answer that question for you. It's a great way to reach a real medical volunteer, and most of the time we get back to you, quicker than 24 hours as well. So it's great to talk to a real person.
Wow, very nice.
Thank you, ladies, for joining me, and I will let you go. We're going to sign off from here. Thanks so much.
Take care, everyone. Be safe.
Bye-bye.